Hello, do you have trouble urinating or difficulty fully emptying your bladder? Did you know these symptoms could be related to an enlarged prostate? Could changes in your diet help relieve this discomfort and even contribute to reducing the size of your prostate? Believe it or not, around 88% of men nearing their 90s will develop prostatic hyperplasia, a significant enlargement of the prostate. This growth can gradually compress the urinary canal, making it harder for urine to pass through. As a result, many men experience uncomfortable symptoms such as pain during urination, difficulty emptying the bladder, and even urinary retention. These issues can cause considerable discomfort and negatively affect quality of life starting in middle age. Benign prostatic hyperplasia, a condition that affects many men over the age of 50, can be managed with healthy habits. Today, discover 4 foods that can become your allies in maintaining men's health, as well as which foods you should avoid. So, don't go anywhere and stay with us until the end of this video. If you're a woman, take note of these tips and share them with your husband. We know that men often neglect their health, but your determination can make all the difference. Now, if you're a man watching my videos, pay attention. Today's content is made especially for you and is unmissable. Let's talk about steps that can transform your health. Have you heard of benign prostatic hyperplasia? Comment here if this term is familiar to you. This is a common condition in men over 50, characterized by an enlargement of the prostate due to the growth of gland cells. It's important to note, this cell growth is not related to prostate cancer, and furthermore, this condition does not develop into cancer. Rest assured. Generally, around the age of 50, men begin to see a urologist who performs a physical exam, including a digital rectal exam, to assess the size and texture of the prostate. Additionally, blood tests such as the PSA may be requested, as its levels can be elevated in prostatic hyperplasia. It's important to remember that PSA levels can rise for other reasons, such as prostate inflammation or even in cases of prostate cancer. In addition to these tests, a urine analysis can help the doctor identify urinary infections or other prostate-related issues. If necessary, the doctor may recommend additional tests, such as ultrasound, MRI, or CT scans, depending on the clinical situation. These tests help determine the size and shape of the prostate and, most importantly, rule out other conditions such as prostate cancer. A biopsy, which is a more invasive test, may be recommended when there are changes in the digital rectal exam or when PSA levels are elevated, indicating a possible suspicion of prostate cancer. It is important to emphasize that imaging tests do not replace the rectal exam. In other words, the physical exam is essential and cannot be overlooked. The physical exam remains the most important in the prevention and care of prostate health. Nowadays, with so much health information available, I believe the stigma around the digital rectal exam has decreased, right? Returning to benign prostatic hyperplasia, managing this condition typically requires regular monitoring of symptoms and urinary function. If you're diagnosed with hyperplasia, you'll likely need to undergo periodic tests to check the size of the prostate, PSA levels, urine tests, and assess kidney function. For mild to moderate cases, treatment typically involves more conservative approaches, such as dietary adjustments, lifestyle changes, and the practice of urinating whenever you feel the urge, helping to prevent urinary retention. Currently, there are various medications to treat prostatic hyperplasia, such as alpha blockers, doxazosin, tamsulosin, which help relax the muscles of the prostate and bladder, improving urinary flow. There are also 5-alpha reductase inhibitors, finasteride, dutasteride, which help reduce the size of the prostate. In more severe cases or when medications are ineffective, minimally invasive procedures may be performed, such as transurethral resection of the prostate or laser treatments, known as laser vaporization. In very rare and severe situations, total prostate removal may be necessary. Now that you know a bit about prostatic hyperplasia, what can be done to help reduce the prostate naturally? As I mentioned, for mild and moderate cases, conservative approaches are recommended. If your prostate is slightly enlarged, this is the perfect time to incorporate foods into your diet that can help control the prostate size. Since it can continue to grow over time without proper care, it's best to start including these 4 foods in your diet as soon as possible. European researchers conducted a literature review from 1964 to 2021, and the results suggest that the Mediterranean diet can play a positive role in managing prostate enlargement. Those who follow this dietary pattern experience an improvement in urinary symptoms. These foods are part of the Mediterranean diet. Now, let's explore the 4 types of foods that can be beneficial for your prostate health. The first food, vegetables and greens. These foods are rich in vitamins, minerals, and antioxidants. which play a crucial role in protecting prostate cells from oxidative damage and inflammation. Additionally, vegetables and greens are excellent sources of fiber, essential for maintaining a healthy digestive system. So, what's the connection between the prostate and the digestive system? Maintaining good digestive health also benefits prostate health, as it helps prevent constipation and the buildup of toxins in the body. Additionally, regularly consuming vegetables and greens helps maintain a healthy weight. We know that excess weight and obesity are linked to a higher risk of prostate issues, including both prostate cancer and benign prostatic hyperplasia. Therefore, include more vegetables and salads in your daily diet to take care of your overall health. Second food, red fruits. Did you know that tomatoes are a fruit? That's right, they are an excellent source of lycopene, a powerful antioxidant that helps protect prostate cells by combating damage caused by free radicals. Studies have shown that regular consumption of lycopene-rich foods, like tomatoes, is associated with a lower risk of developing prostate cancer. Interesting, right? So, let's add more tomatoes to our diet by increasing daily servings. Additionally, other red fruits like cherries, strawberries, and blackberries, which are easily found in the market, are also great options. In other words, make sure to get a daily dose of lycopene for your health. The third food on the list is nuts. These oil seeds, such as walnuts, almonds, and pistachios, are rich in omega-3, a nutrient with anti-inflammatory properties that offers many health benefits, including for prostate health. We know that chronic inflammation can contribute to the development of prostate problems, such as benign prostatic hyperplasia. Therefore, including omega-3-rich foods can help reduce inflammation and, consequently, shrink the prostate. In addition, Brazil nuts are an excellent source of selenium, an antioxidant mineral that can also help in the prevention of prostate diseases. Other nuts, such as cashews and almonds, are good sources of zinc, which is essential for immune function and sperm production, as well as being important for prostate health. And let's not forget that nuts are rich in antioxidants, such as vitamin E and phenolic compounds, which protect prostate cells from free radical damage. So, my simple tip is this: grab a handful of mixed nuts and add them to your daily diet. This will bring benefits not only to your prostate but also to your heart. Fourth food, omega-3-rich fish. Fish are an excellent source of lean protein and provide a variety of nutrients that are beneficial for prostate health. Varieties such as salmon, sardines, tuna, and trout are rich in omega-3, a nutrient that, as I've mentioned before, helps reduce inflammation and may shrink the prostate. In addition, fish provide high-quality proteins which are essential for maintaining muscle health and a strong immune system. Another benefit is that a diet rich in lean proteins helps with weight control, preventing obesity, a significant risk factor for prostate diseases. Therefore, these are the 4 essential food groups to include in your daily diet, helping to promote prostate health and keep you in good shape. So, what food should you avoid? First, red meat. Especially processed versions like sausages, bacon, ham, and hot dogs, which are high in saturated fat. Excessive consumption of this type of fat has been linked to an increased risk of cardiovascular diseases and prostate-related issues. As with everything in life, the key is balance and moderation. It is perfectly fine to include red meat occasionally in a healthy, balanced diet. The issue lies in excessive and frequent consumption, particularly of processed varieties, which can cause serious health problems. Another important point is alcohol consumption. Excessive alcohol can cause inflammation in the body, increase prostate size, and even be a risk factor for prostate cancer in the future. Well, I hope you enjoyed the video. If you did, share it with your friends, subscribe to the channel, and activate the notification bell to continue receiving health tips like these. A big hug and see you in the next video.